Welcome, and thank you for standing by. At this time, all participants are in a listen-only mode until the question and answer session of today's conference. You may press star 1 on your phone now to join the queue for questions. I would like to inform all parties that today's conference is being recorded. If you have any objections, you may disconnect at this time. I would now like to turn the conference over to Julie Iriondo. Thank you. You may begin.
Good morning, and thank you for joining us. I'm Julie Iriondo, Chief of the Media Relations Branch in the Public Information Office at the U.S. Census Bureau. Today, we are releasing the latest income, poverty, and health insurance findings for the nation. We will have 3 presenters today to walk through the findings. The presenters are David Waddington, Division Chief, Liana Fox, Assistant Division Chief for Economic Characteristics, and Sharon Stern, Assistant Division Chief for Employment Characteristics, all from the Census Bureau's Social, Economic, and Housing Statistics Division. Immediately after the presentations, we'll begin taking your questions. In order to ask a question, you'll need to press star 1 to get into the virtual queue. And if you already know what you'd like to ask, you can join the queue now by dialing star 1. Without further delay, I'll now turn it over to David Waddington. Dave?
Good morning, and thank you for joining us today. This morning, we are releasing 3 reports: income, poverty, and health insurance coverage in the United States for 2024. These reports are based on data from the Current Population Survey's Annual Social and Economic Supplement, or CPS ASEC. The Current Population Survey is the longest-running survey conducted at the Census Bureau and is the official source of the national poverty estimates. Now, let's take a look at the main findings. Real median household income was $83,730 in 2024, not statistically different from 2023. Recessions, as defined by the National Bureau of Economic Research, are depicted in this and all time series charts in light shading. The official poverty rate fell 0.4 percentage points to 10.6% in 2024. There were 35.9 million people in poverty. The Supplemental Poverty Measure, or SPM, extends the official poverty measure to include the value of non-cash benefit, taxes, and other necessary expenses. The SPM rate in 2024 was 12.9%, not statistically different from 2023. The percentage of people with health insurance coverage for some or all of the calendar year 24 was 92%, meaning that 8% of the population had no insurance the entire year. Now let's turn to our subject matter experts and take a closer look at the findings. Liana Fox will present the main findings on income and poverty reports. As a reminder, we'll take your questions immediately following these presentations.
Thank you, Dave. Good morning. Income and poverty statistics help us measure the economic well-being of the nation's population. Most of the income estimates in my presentation are based on money income, which is a measure of cash or money resources coming into a household. It includes wages and earnings from work, as well as Social Security benefits, unemployment compensation, retirement income, interest, dividends, and public assistance. It is pre-tax and therefore does not account for taxes paid or tax credits received. It also does not account for non-cash assistance. Let me begin by summarizing the main income and earnings findings. Between 2023 and 2024, median household income did not change significantly. Household income increased 4.2% at the 90th percentile, but did not change significantly at the 10th percentile. Among full-time year-round workers, median earnings increased 3.7% for men, but did not change significantly for women. For full-time year-round workers, the female-to-male earnings ratio fell from 82.7 to 80.9%. Now let's take a closer look at these findings. This chart shows median household income estimates from 1967 to 2024 in real inflation-adjusted dollars. This adjustment reflects a 2.6% increase in consumer prices between 2023 and 2024. The median represents the midpoint in the income distribution. Half of households have income above the median and half are below the median. Median household income was $83,730 in 2024, not statistically different from 2023. Now looking at income by race and Hispanic origin. Asian households had the highest median income in 2024, followed by non-Hispanic white and Hispanic households. Black households had the lowest median income. Of these groups, median income for Asian and Hispanic households increased significantly between 2023 and 2024, while median income for Black households declined. Median income for non-Hispanic white households did not change significantly. More details can be found in an America Count story that will be released later today. The Gini Index is a measure of income inequality that ranges from 0 to 1, with 0 representing total equality and 1 representing total inequality. The Gini Index was 0.488 in 2024, not statistically different from 2023. In addition to the median or 50th percentile, examining other points along the income distribution provides insight into how lower and higher income households fared. At the top end of the income distribution, household income at the 90th percentile rose by 4.2% between 2023 and 2024. Household income did not change significantly at the 50th or 10th percentile. This slide adds in post-tax income, which accounts for federal and state income and payroll taxes. Pre-tax money income is the same series we saw in the previous slide. Between 2023 and 2024, post-tax household income increased 3.1% at the 90th percentile and 1.8% at the median. Similar to pre-tax, post-tax income did not change significantly at the 10th percentile. In 2024, pre-tax money income was higher than post-tax income at all 3 percentiles shown in the figure. Estimates of post-tax income and inequality are included in Appendix B of the income report, and we also have an America Count story that comes out today comparing pre- and post-tax income inequality. These next slides look at earnings for full-time year-round workers aged 15 and older by selected characteristics. Earnings are the sum of wages, salary, and self-employment income. Earnings comprise 77% of aggregate income in 2024. A full-time year-round worker is a person who works at least 35 hours per week and at least 50 weeks per year. In 2024, median earnings for full-time year-round workers were $63,360, not statistically different from 2023. Looking at race and ethnicity, Hispanic individuals were the only group displayed here to experience significant change in median earnings, increasing 4.9% between 2023 and 2024. Now looking at earnings by educational attainment for workers aged 25 and over, we see that those with no high school diploma saw the largest increase in median earnings between 2023 to 2024, but they still had the lowest median earnings of all educational attainment groups. Median earnings also increased for those with some college experience. Today, we will also release an America Count story highlighting income and earnings by education over time. Here we see historical median earnings for full-time year-round workers by sex. Between 2023 and 2024, median earnings for full-time year-round workers increased 3.7% for men, but did not change significantly for women. The ratio of these estimates is called the female-to-male earnings ratio. The earnings ratio declined to 80.9% in 2024. This means that women earned about 81% as much as their male counterparts. This is the second consecutive annual decline in the female-to-male earnings ratio. To find our full income report and additional resources, please visit our website. Now let's turn to poverty. The Census Bureau produces 2 poverty measures each year, the official poverty measure and the supplemental poverty measure, also known as the SPM. In 2024, the official poverty rate was 10.6%, down 0.4 percentage points from 2023, while the SPM rate was 12.9%, not significantly different from 2023. We'll discuss each of these measures in turn, beginning with official poverty. The official poverty measure, established by the Office of Management and Budget Statistical Policy Directive 14, uses the same definition of money income as the income estimates discussed earlier. The components are shown again here. Poverty status is determined by comparing money income to a poverty threshold. The official poverty threshold is adjusted for family composition, but does not vary by geography. In 2024, a family with 2 adults and 2 children was classified as in poverty if their income was less than $31,812. Here we have our official poverty rates and the number of people in poverty from 1959, our first year of estimates, to 2024. In 2024, the official poverty rate was 10.6%, down 0.4 percentage points from 2023. There were 35.9 million people in poverty in 2024. This slide shows official poverty rates by age. Between 2023 and 2024, official poverty rates declined for children and adults aged 18 to 64. The child poverty rate fell by 1 percentage point to 14.3, while the rate for 18 to 64-year-olds fell by 0.4 percentage points to 9.6 in 2024. The official poverty rate for those aged 65 and older was 9.9%, not statistically different from 2023. Here we have trends in official poverty by race and Hispanic origin. From 2023 to 2024, official poverty rates fell for Asian and Hispanic individuals, but did not change significantly for non-Hispanic white and Black individuals. Poverty rates for additional race and Hispanic origin groups are available in the report. Now let's turn to the supplemental poverty measure. The FPM uses different resources and thresholds than the official poverty measure. FPM thresholds are produced by the Bureau of Labor Statistics using consumer expenditure survey data and vary by family composition, housing tenure, and geography. On the resources side, the FPM adds non-cash benefits from government programs like housing, utility, and nutritional assistance programs, and subtracts taxes and necessary expenses, such as work, childcare, and medical expenses. This slide presents FPM and official poverty estimates back to 2009. The official poverty estimates shown here include unrelated individuals under the age of 15, so that the two measures can be compared directly. In 2024, the FPM rate was 12.9%, 2.3 percentage points higher than the official rate. Next, we look at child poverty. Due to the inclusion of governmental programs targeted at families with children, including tax credits and nutritional assistance programs, child poverty as measured by the FPM has historically been lower than the official poverty measure. That divergence grew in 2020 and 2021 due to pandemic-era stimulus payments and programmatic expansion. But the gap has narrowed since then, down 0.9 percentage points to 2024. In 2024, when the FPM rate for children was 13.4%. Looking at adults aged 18 to 64, the FPM rate was 12.2% in 2024, 2.6 percentage points higher than the official rate. The 2024 FPM rates for both children and 18 to 64-year-olds were not statistically different from 2023. Turning to adults aged 65 and older, the FPM rate increased 0.8 percentage points between 2023 and 2024 to 15%. We see the largest divergence in the two poverty measures for this group, with the FPM rate 5.1 percentage points higher than the official rate. This is largely due to the FPM subtraction of medical expenses from resources. We now turn to FPM rates by race and Hispanic origin. Of the groups shown here, Black and Hispanic individuals had the highest poverty rates in 2024, followed by Asian and non-Hispanic white individuals. Of these groups, only the poverty rates for Black individuals changed significantly from 2023, increasing 2.2 percentage points. Finally, the FPM allows us to gauge the effectiveness of tax credits and transfers in alleviating poverty. It also lets us see how necessary expenses can increase poverty. This figure shows how the number of people in poverty changes if we add or subtract a single resource element from the FPM. It shows the effect for both the overall population and by age. Some of these elements, like Social Security and unemployment insurance, are included in official poverty estimates. Others, like refundable tax credits and medical expenses, are included only in the FPM. Using this chart, we can see that 28.7 million people were taken out of poverty by Social Security benefits. Approximately 70% of these individuals were aged 65 and older. 6.8 million people were taken out of poverty by refundable tax credits. Finally, 7.5 million people were pushed into poverty by medical expenses. Please visit our website to find the full poverty report and additional resources. Next, Sharon Stern will summarize the findings for health insurance.
Thank you, Liana. Health insurance is an important measure of our nation's overall well-being. With a health coverage plan, people have greater access to medical care and protection from high unexpected costs. This in turn provides more economic stability. Let me begin by summarizing the main finding this year. 8% of the population, or about 27.1 million people, did not have health insurance coverage at any point in 2024. The uninsured rate was not statistically different from 2023. This chart presents the uninsured rate from 2013 to 2024 to provide context. The uninsured rate declined from 2013 to 2014 when many provisions of the Patient Protection and Affordable Care Act went into effect and continued to decline through 2016. After switching to a new processing system, the 2017 rate was 7.9%. 2024 saw no change in the uninsured rate compared with the previous year, and the rate remains near historic lows at 8%. This figure shows uninsured estimates for the same period by different age categories. There were no changes between 2023 and 2024 for the age categories presented. Working age adults consistently have the highest uninsured rates, while the rates for adults 65 and older are lowest, hovering around 1%. Looking at the uninsured rate by race, we see that there was an increase in the uninsured rate for Black individuals between 2023 and 2024. In 2024, Hispanic individuals had the highest uninsured rate, while non-Hispanic white individuals had the lowest uninsured rate. Turning now to look at the type of health insurance coverage, it's important to note that people are counted as insured if they had coverage at any time during 2024, even if they did not have coverage for the full year. Further, some people may be counted in multiple categories if they held different types of coverage during the calendar year. In 2024, most people, 92%, had health insurance coverage during the calendar year. 66.1% of people held private coverage. Employer-based insurance was the most common subtype of coverage overall, covering 53.8% of the population, while 10.7% of people purchased their coverage directly. In 2024, 35.5% of people had public coverage, which includes Medicare, Medicaid, and VA and CHAMP VA coverage. The chart on the right shows the change in health insurance coverage between 2023 and 2024. The increase in overall private coverage offset the decrease in overall public coverage, resulting in no statistically significant change in the uninsured rate. Among private coverage types, direct purchase coverage and TRICARE coverage increased between 2023 and 2024, while the rate of employer-based coverage did not significantly change. The decline in public coverage overall was driven by a decrease in Medicaid coverage to 17.6% in 2024, down from 18.9% in 2023. The percentage of people with Medicare coverage increased in part due to growth in the number of people 65 years and older, rather than a change in the Medicare coverage for adults in the same range. This chart shows selected coverage types and age groups. Consistent with the overall picture, we see that private coverage rates increased for both children under the age of 19 and adults aged 19 to 64, driven by an increase in direct purchase coverage. Similar to the overall picture, both groups saw a decrease in public coverage rates, driven by a decrease in Medicaid coverage. This chart also shows that children were more likely to be covered by insurance than adults 19 to 64, in part because children under the age of 19 may qualify for public programs such as the Children's Health Insurance Program. More information is available in our report, supplemental tables, and America Account Story. Now I'll turn it back to David Waddington.
Okay, thank you, Sharon and Liana. That concludes our presentations. To recap the highlights, real median household income was $83,730. The official poverty rate was 10.6%. The SPM rate was 12.9%, and the uninsured rate was 8%. And now I'll turn things back to Julie, who will lead our question and answer session.
Thank you, Dave. We're now ready to begin taking questions. As a reminder, for questions not related to today's findings, please contact the Public Information Office at pio@census.gov. We're happy to help. Operator, can you please provide instructions on how people can submit their questions?
Thank you. At this time, if you would like to ask a question, please press *1 on your phone. Please ensure that your phone is unmuted and state your name clearly when prompted. Again, that's *1 to ask a question. If you need to withdraw your question, please press *2. One moment, please.
Thank you, Operator. As we wait for questions to queue up, I'd like to mention that resources for today's release can be found in our press kit on census.gov. Just go to the newsroom or look for the Income, Poverty, and Health Insurance banner in the upper left-hand corner of the homepage. In the press kit, you'll find the news release, full reports on income, poverty, and health insurance, graphics, blogs, several American Count stories, the slide deck, and more. The press kit will be updated throughout the news conference, so please keep checking. Okay, now let's go to the questions. Operator, do we have our first caller?
Our first question is from Christopher Rugaber with Associated Press. Go ahead, your line's now open.
Hi, Chris.
Hi, how's everybody doing? So my question is just on the general income number. It looked, other measures of, say, personal income through the Commerce Department show, even adjusted for inflation, a little bit of a bigger gain than what you're seeing. Can you explain why the median is a relatively small increase? Is that because of the higher gain among higher income households? Is there more skew? Is it because households, that's a different measure, of course, than, say, per capita, so maybe fewer people working, or, what can you say about this very small increase, relatively speaking, in median income? Thank you.
Thanks, Chris, for that question. This sounds like a question for Liana on income numbers and how we measure.
Hi, Chris. Thank you for that question. So when you look at our income distribution, we see that the median kept pace with inflation. So wages and income, so wages from earnings as well as household income, kept pace with inflation. We saw increases at the 90th percentile in both pre- and post-tax measures. And while we didn't see changes at the 10th percentile, we did see decreases in official poverty. So what we're seeing here, the household income includes a lot of different components. So it's not just wages and earnings, even though that's about 77% of aggregate income. It's also including Social Security benefits. It includes, I went through the whole list. I guess I probably don't need to repeat that. But it includes a whole host of different factors. And again, this is income from 2024, and we're comparing it to 2023. So we see that we kept pace with inflation, which was 2.6%.
Great, thank you.
Any follow-ups? Are you good?
Well, yes, actually, just a quick follow that I'm sure other people would ask. Can you tell us also a little bit about the growth in gaps between men and women earners? Second decline in a row. I think last year there was a talk that maybe this was focused among Hispanic women, but is that still true, or what can you say about why we're seeing this drop in 3.7% gain in male earners and no gain among women?
Sure. Thank you for that question. So for the last 2 years, we've seen the gap, the female to male earnings ratio declining, and that has been because when men's earnings have outpaced women's earnings. So in this year, we had an increase of 3.7% for men's earnings, while women's earnings were relatively flat at the median. And again, a median is a little hard to decompose because you have people moving both in and out of the labor force, in and out of full-time year-round employment. There's not a clear story of a certain demographic group that seems to be driving this trend. Between 2022 and 2023, we saw both men and women having increases in earnings for full-time year-round workers. It was just that men's earnings outpaced women's. So part of this is just offsetting some gains that we saw during the pandemic and during the early 2020s. The male-to-female earnings ratio for 2024 is not statistically different from 2019. So we're kind of back to that place where we were pre-pandemic.
Okay, great. Thank you.
Operator, do we have our next caller?
Our next question is from Tammy Luby with CNN. Thank you. Your line's now open.
Hi, Tammy.
Thank you very Hi. Thank you so much for holding this call. Two questions. One is the labor market was fairly strong last year, and I know I heard what you just said, that wages are not all of the components, but the labor market was fairly strong. Wages did rise above inflation. So why again, I guess what were the labor market contributions to income as well as to poverty? And would you say a 0.4% increase or decrease in poverty, would you call that like a slight decrease, or what adjective would you use with that?
Thank you for your question, Tammy. It sounds like labor market contribution and the poverty rate.
Mm-hmm.
Hi, Tammy. Thank you for your question. I'm not sure if I have too much to add from what I just had said. We're looking at a nationally representative sample of individuals. We're seeing that household income and earnings kept pace with inflation. So we saw earnings for all workers was not significantly different from 2023, same with full-time year-round workers. So if we look at them as a full group, we just didn't see increases above inflation. So they kept pace with inflation. It's a story of stability, but not necessarily growth, except at the top end of the income distribution, we did see increases at the 90th percentile. In terms of what adjective I would like to use to describe a 0.4 percentage point increase or decrease in poverty, I would say it's a modest decline, right? So this is 0.4 percentage points. It's a modest decline.
Okay, thank you so much.
Thank you.
Thank you. As we wait for the next question to queue up, we want to highlight the blogs with this release. In the press kit, you'll soon find several blogs, and currently we have two pre-release blogs that came out last week, one on comparing poverty measures, the other on how inflation affects the Census Bureau's income and earnings estimates. The two new blogs that will be released today, the first is using administrative data to evaluate non-response bias, and the second, how updating annual poverty thresholds impacts poverty rates. Operator, do we have our next caller?
Our next question is from Lydia DePhillis with the New York Times. Thank you.
Hi. Thank you guys for doing this. Hi. So one of the striking data points across all of these reports is a decline for Black Americans in insurance coverage, increase in poverty, decrease in income. Is there anything that you can see that might be driving those negative outcomes for Black Americans in particular?
Thank you for that question. We have a question related to the Black population in various ways. Sharon, would you like to start on that one?
Sure. Thank you for that question. It's absolutely the case that these results are telling a story similar across these topic areas. What I can tell you about the Black population and health insurance coverage is that, like other groups, they saw an apparent decrease that was not statistically significant in their Medicaid coverage. So these are somewhat consistent stories.
Liana, would you like to provide some additional information?
Sure. So we actually are releasing an America Counts story today that looks at income and earnings by race and Hispanic origin. So I'd encourage you to check that out, because not only are we showing year-to-year changes between 2023 and 2024, we're also taking a longer time frame and looking at 2019 to 2024. So I can say that for Black households, it's a mixed bag. So for median household income, we do see that there is a decline of 3.3% for median household income for Black householders, but there's no change in earnings for full-time year-round workers, Black workers. Same with when we're looking at poverty. So there was no change in the official poverty status of Black individuals, but we did see an increase in poverty of 2.2 percentage points for Black individuals using the SPM. So there's a mixture of factors, but if you go and you look back to 2019, earnings are up for Black, Asian, and Hispanic full-time year-round workers. And there's basically no statistically significant differences between 2019 and 2024 for most of the race categories that we look at, except for Hispanic families that had an increase in their household income between 2019 and 2024.
And as Liana mentioned, America Count story that will be released that helps provide additional information. Operator, do we have our next caller?
Yes, our next caller is from Monica Potts. Go ahead, your line is now open.
Hi, Monica.
Hi, thank you all for doing this today. I have seen other estimates, especially from like the Economic Policy Institute, that have shown real hourly wages rising from the bottom and kind of a compression of inequality. And it doesn't look like, I could be wrong, but it doesn't look like that's translating to a rise in real annual incomes from the bottom. And I'm wondering, you know, what might account for that? Are people working less hours at higher hourly rates, or does the data not have that information?
Thank you for your question, Monica. It sounds like this is a question related to inequality and wages. Liana, would you like to take this one?
Sure. Thank you, Monica, for this question. I don't know that CPS ASEC is really the best data source to look at hourly wages. We're looking at total income over an entire year, so we're asking about annual income for the prior year. Other data sources like the outgoing rotational group from the current population survey is really better for measuring hourly wages. So we're also primarily focusing on the median. So when we're looking at earnings at a lower end of the distribution, we're really not picking that up in this data, or we're at least not analyzing it in what we're doing. We put the data out there. We look forward to having other folks dig through and do that research. So I guess we can't really see that in the results that we're putting out, but we have hundreds of additional tables, and we put out the microdata, and we look forward to seeing what other people find in this analysis. Thanks.
Thank you.
Thank you for your question. Operator, do we have the next caller?
Our next question is from Elisa Church with SWODA. Go ahead, your line is now open.
Hi, Elisa.
I think she just cleared her question. Elisa, if you have a question, please press *1 on your phone again. Our next question is from Thomas Chapman with Ohio Department of Medicaid. Go ahead, your line is now open.
Hi, Thomas.
Hello. You have about 340 million people in America. The one slide shows about 1.3% decline in Medicaid. So that's about 4.4 million is your estimate. Is that correct?
Is this your question?
Yeah.
So we have a question about the decline in Medicaid. Sharon, would you like to take this one?
Hi. Thank you for that question. All of the detailed information is available in the appendix to our report. So at Table A1, I take that back. Table A1 is not the table. You'll have to look online to see the table. Apologies. We do have those numbers online. In Table 1, we show that the number of people with Medicaid in 2024, we estimated was 59.4 million, and in 2023, we estimated it was 62.7 million. One of the issues with making that direct comparison has to do with the population controls that we use. So when looking at the comparison of the total population, we also have a working paper that we're releasing today that describes what the difference would have been if you'd used our other population skills. I'm sorry that that's a complicated story. It's not an easy answer. But if you'd like help with the exact numbers and how to interpret by using the working paper estimates and Table 1 in today's published report, we'd be happy to help you offline afterwards.
Okay, thank you.
Thank you for your question. As we wait for the next question to queue up, we want to highlight the America Count stories that are with today's release. As mentioned, you can find the links in our press kit. The stories include one that looks at health coverage by occupation, another on how education impacted income and earnings. Additional stories include inequality in the tax system, estimated median household income, and a comparison of the supplemental poverty measure and the official poverty rate by state. Operator, do we have our next caller?
Our next question is from Tammy Luby. Go ahead, your line's now open.
Hi, thank you. Hi again. Thank you for holding having my call again. So I just had a question. If I wanted to look at the comparison with median household income in 2020, I see that the number was 81,580. Can you tell me if that's statistically significantly different than the 83,730?
Thank you for your question, Tammy. We have a question about the comparisons to the 2020 median household income. Liana?
Hi, Tammy. I would have to double check that and make sure I do the stat test. I can tell you that the median household income for 2024 was not statistically different from 2023 and was not statistically different from 2019, but I don't have the 2020 stat test right in front of me. But if you call back, I can make sure I have that for you.
You want me to call back, or will someone email it to me, or?
Tammy, we can connect offline and answer that question.
Thank you.
Operator, do we have anyone else in the queue? While we wait for the next question to queue up, I'd like to note a few of our upcoming major releases. On Thursday, September 11th, the 2024 American Community Survey one-year estimates will be released. Embargo access for credentialed media started at 10 o'clock this morning. You can find more information in our newsroom under helpful links. On December 11th, the 2020-2024 American Community Survey five-year estimates will be released. More details about these releases can be found in our newsroom on census.gov, or you can email us at pio@census.gov. Operator, do we have our next caller?
Our next question is Christopher Rugaber with Associated Press. Go ahead, your line's now open.
Hi, Chris.
Hi, thanks. Just a quick follow as well. I just, on the men and women pay, just want to make sure I'm reading it right. It looks like, women's pay did, full year, year-round workers did rise 1.5%, which I guess is not statistically significant, but it's not zero, just to make sure I have that right.
Thank you for your question. Liana, we have a follow-up on men and women earning.
Sure. Thanks, Christopher, for that question. So it's not zero, but because of the margins of error and measures of uncertainty that we put into our survey data, we wouldn't say that we say it's not statistically different from zero. So the point estimate, you are correct, is 1.5%, but we wouldn't call that an increase because it's not, the margin of error is not small enough to consider it a significant increase.
Right, okay. Yeah, thank you.
Thank you for your question. Operator, do we have our next caller?
Our next question is from Andrew Keshner with MarketWatch. Go ahead, your line's now open.
Hi, Andrew.
Hi there. Thank you for holding this. Could you just give any more color on what is driving the top 90th percentile, that increase in income? Is that investment income? Is that statistically significant, what we saw in 2024 for them?
Thank you for your question. We're looking for additional explanation on what's happening with the 90th percentile. Liana?
Hi, Andrew. Thank you for that question. I don't have a decomposition of exactly which elements of household income are increasing for the 90th percentile. It's likely a combination of factors. We do have some detailed tables that we put out, and if you call back, we can definitely point them to you point you to them. But I don't have like a specific item that I would point to and say that's really driving the increase of the 90th percentile. It's likely a combination of factors, including earnings, which are a vast majority of income, especially at the higher end, but likely also some other elements as well. Thank you.
Thank you for your question. As we wait for the next question to queue up, a reminder that the embargo for the ACS release is underway, and it's not too late to sign up, so we'd like to take a moment to go over the embargo policy with you. Access is limited to accredited media who give their chief attention to the gathering and reporting of news. Embargoed news releases and data may not be released to the public by any means before the specified date and time of the release. For this ACS release, the embargo ends at 12:01 a.m. on Thursday. Embargo access is granted on an individual basis only. Embargoed data cannot be shared or discussed with colleagues or associates that have not been approved. Media representatives are required to register using an email address associated with the media outlet. Group or generic email addresses will not be accepted. To sign up, visit our newsroom and look for the link to the embargo. And if you have any questions, please reach out to pio@census.gov. We are happy to help. Operator, do we have our next caller?
Our next question is from Jasmine Tucker with National Women's Law Center. Go ahead, your line's now open.
Hi, Jasmine.
Hi, thanks so much for this. I wanted to ask a question about the female-to-male earnings ratio for full-time year-round workers. So last year in 2023, we saw the first statistically significant widening in 20 years, and I just wanted to check if the report doesn't say, I don't know if you guys mentioned it, is this change statistically significant for the second year in a row? It is.
Thank you for your question, Jasmine. Liana, can you answer this one about second year in a row for female and male earnings?
Hi, Jasmine. Yes, it is. It is a significant increase again, or a decrease again this year. So the last 2 years, we've had significant decreases in the female-to-male earnings ratio due to larger wage gains for men than for women. And we have all of the in the reports. We have historical female-to-male earnings ratio. You see them on the figure here, but they're also detailed in the reports going back to 1960.
Thank you for your question. And that will be our final question. If you have additional questions after today's event or would like to request an interview with one of our subject matter experts, please contact the Public Information Office at 301-763-3030 or email us at pio@census.gov. And as a reminder, you can find resources from today's release in our Income, Poverty, and Health Insurance Press Kit. You can find the press kit linked on our homepage or in the news section of our website. I'd like to thank today's presenters, Dave Waddington, Liana Fox, and Sharon Stern. I'm Julie Iriondo. Thank you for joining us and have a great rest of your day.